The most common form of hearing loss occurs as a natural part of aging and is called presbycusis. This type of hearing loss is typically worse at higher frequency sounds, so it interferes with speech recognition and music appreciation. Men tend to experience greater hearing loss than females, perhaps because they have historically worked in louder environments. But it is unknown how much the differences in hearing between genders are caused by biological or social factors. Hearing can impact an individual's safety risks. For example, the sense of hearing allows a person to locate objects around them, making noise without much conscious thought. However, sounds like fire alarms or ambulance sirens warn people of emergencies. To understand how sound affects safety, try wearing noise-canceling headphones or earplugs while seated in a populated, busy area. Notice how the lack of hearing changes your perception of movement and the location of objects in your environment. To assist individuals with hearing loss, use other senses, such as vision and touch, to aid in communication. Stand directly in front of the person when you are speaking. Use appropriate gestures to guide actions, and use a light touch to gain their attention or assist in movement. People with hearing loss may become frustrated if they are unable to communicate effectively and may withdraw from interaction with others if hearing loss is profound. Be sure to utilize communication techniques described earlier in the course to prevent isolation. Hearing aids make sounds louder, but do not help in every environment. Even with hearing aids, it can be difficult for individuals to hear a conversation in a large open space, or if there is other background noise, such as music, television, or other conversations. If a resident has hearing aids, be sure they are cleaned regularly and change the batteries once a week. Wax can be removed with a monofilament tool provided with the hearing aids. Some hearing aids have rechargeable batteries that should be charged each night while the resident sleeps. See the image of a hearing aid in a case with a battery and a cleaning tool. Hearing aids are expensive for residents to purchase, so it is important to always handle them with care and store them in an appropriate place so they are not lost. If you are unsure of how to fit a hearing aid into a resident's ear, ask for assistance from the nurse. Hearing aids can fit completely inside the ear or over the top of the ear. See the image for an example of a hearing aid that is placed over the top of the ear. See the simulated hearing aid placed inside a mannequin ear.